Good afternoon, everyone. My talk is on PEMF, an adjunct to chemotherapy. Many of you would wonder what PEMF is, and as we get into it, it'll make a lot more sense. It's an alternative approach. It's a form of energy medicine, and so let's get to it. Which button? Where did it point? Sorry. I'll talk while the next slide comes up. You have cancer. Those are some of the most awful words a patient can hear. It's also one of the most unpleasant tasks as a physician to tell a patient that they have cancer. After hearing that news, there are two big things. Two big things. How bad is it? And what are my options? Sometimes the treatment can be as simple as observation. In other instances, it calls for medication, and medication can be tablets. It can be given by injection, intramuscular, intravenous. There's radiotherapy and also surgery. These treatments are, next slide. Go back. Sorry. Yeah, so these treatments are traumatic. In terms of surgery, there's loss of sometimes organs, lymph nodes, and sometimes, and in the case of chemotherapy and radiotherapy, there is toxicity to the body. The well-known case of Angelina Jolie, in her case, she did surgery prophylactically to prevent cancer to spread to her body. And as I was saying, cancer treatments are traumatic. Trauma, as was mentioned before by Dr. Lewis, the trauma isn't just physical, it's also mental. In the terms of a woman losing her breast, that is traumatic emotionally, and a man in terms of the prostate, and also in terms of, in a case where, for example, you wake up with a colostomy, and all of a sudden things have changed for you. So, oftentimes, or many times in terms of treating cancer, the cancer becomes prominent and the state of the health of the individual becomes secondary to the cancer diagnosis. Sorry, I need to... The hypertension, diabetes, heart disease. I apologize. I just feel very constricted behind here. And I'll ask that the slides don't be changed. Right. The hypertension, diabetes, heart disease, and arthritis no longer hold much importance. However, the cancer is not separate from the person. And the factors that brought the cancer about are often the factors that trigger the other processes. In fact, obesity and diabetes are risk factors for certain cancers. As you can see, I'm having a difficult time with the slides. Our body in a healthy state is in a much better condition to survive the cancer treatments as well as fight the cancer itself. The body does have its own defense mechanism to fight cancer, and it is a powerful and effective system. However, it is often ignored in the traditional approach in the war against cancer. Recent treatment regimens have begun to address this in the form of immune therapy or immunotherapy, but presently the cost of such treatments tends to be prohibitively high and hence only available to a privileged few. Next slide. So in terms of treating cancer patients, the therapy alone isn't important. The person's innate health is also of importance. Correcting metabolic disorders, for example, diabetes. And diabetes is important because it is found that the high glycemic state in diabetes can accelerate the growth of the cancer. In other words, having a high blood sugar does actually make the cancer worse. Controlling the diabetes helps that. So one has to pay attention to the health and not just the cancer diagnosis. In fact, in some cases, a low glycemic diet or even intermittent fasting has been thought to help in terms of cancer therapy. And so these things have an influence. Exercise, and I'm sure Grantley spoke about that, in terms of improving their response, that helps. Boost the immune system. And there are several ways of doing that. As mentioned there are vitamins, supplements, diet and exercise said before, adequate rest. And I touch on adequate rest because sleep is important. Rest is important. Sometimes the best therapy a person can have is rest. Disruption of sleep, lack of sleep causes hormonal imbalances and certainly impairs the immune response. Vitamins, people will have their theories. Everybody has their theories on vitamins, but I speak on vitamin D specifically because that is measurable. And it has been found specifically to be important in immune function. So certainly you want to correct a deficiency such as that. Minimize negative factors. Negative words, a toxic environment can kill an individual's desire to even want to live. They just give up. The will to live and the will to get better has a significant effect on patient outcomes in diseases. Hence, placing a person in a positive environment is another tool in fighting cancer. And in my experience in treating patients, sometimes I think that's the most powerful factor. The environment, the love of a family, the support, the will to get better, and certainly being immersed in the opposite of that has the opposite effect. Next slide. So adjunctive care. Adjunctive therapy refers to additional treatment methods which on their own may not be recognized as particularly effective, but with their combination with conventional treatments can render them more effective on the patient or make the patient more resilient to the side effects of the treatment. Strategies I mentioned already can be considered adjunctive care. That being said, we look at specific treatment that is very useful adjunct. PEMF, pulse electromagnetic frequency therapy. This is considered energy medicine, as I said before, and is where we use an electromagnetic field to have a healing effect on the body. Next slide. Well, how does PEMF work? I know some of the scientists in here will say, well, aren't electromagnetic fields bad for you? Next slide. And this is just a picture of the electromagnetic spectrum. Many of these things you see, we know are harmful to the body. Microwaves, waves from the cellular phone, ultraviolet, X-rays, gamma rays. Now, the importance of this part of the electromagnetic spectrum is that these are high energy, is a high energy part, high frequency, high energy. And when the cells of the human body are exposed to this high energy, it has a damaging effect to the extent that you can have symptoms from tinnitus to headaches to feeling unwell to easily getting infections to even increased risks of cancer. Next slide. Right. That's just a picture of the PEMF device. Obviously, it's deceivingly simple. It's a mat. That mat contains a number of copper coils. An electrical circuit is delivered to those coils, and the radiation from those coils comes out in a pulsed manner. And there's debate as to the best device, the best regimen in terms of frequency and intensity. But overall, one thing is for sure, it's safe, it has minimal side effects. And as we go on, we'll understand why this is an important adjunct. So PEMF is not the high energy EMF that we mentioned before. It uses low and ultra low frequencies, the energy delivered from these frequencies being low as well. The delivery of the energy to the cells allows the damaged cells to effect repairs. It also enhances communication between the cells, so information coordinating the processes involved in the different cell functions is transmitted more easily. In other words, by delivering an energy to the body in such a way that the cells can use it, the function of the body is improved. PEMF also improves microcirculation. Now, this is something that is measurable. In terms of the microcirculation, it is improved, and as I said, it's measurable. Studies have been done to prove that. And understand the importance of the microcirculation. This is the ultimate end of the delivery system, of the circulatory system. Is where oxygen is delivered to the tissue of the various organs and waste products are taken away. So obviously, improvement in the circulation leads to improvement of the organs. The human body is composed of organs and systems, and these all have cells. In order for the cells to function properly, there needs to be good communication between the cells. And another thing that PEMF does is it creates a number of microcurrents, and those microcurrents facilitates the intercellular communication, and with that, improve function of the body overall. Now to the meat of the matter. Specific data. Are there any studies? Well, I'm sharing a few with you. There's a nanosecond pulse electromagnetic fields, a form of PEMF, to cause melanomas to self-destruct. Melanomas being cancerous cells, so you're causing them to self-destruct by submitting them to a PEMF field. In specific detail, the PMS inhibit cancer growth by disrupting the mitotic spindle in a process mediated by interference of spindle tubulin orientation and induction of dielectrophoresis. So there's some laymen in here, there's some doctors in here. It's a very fancy way of saying that at a subcellular level, the processes by which the cancer divides and produces more cells is disrupted. PMF therapy modulates gene expression and protein synthesis, interacting with specific DNA sequences. The DNA is the instructive material within the cancer cells, and cancer cells have different cell DNA to normal cells. So if you sabotage that DNA, the ability of the cancer cells to grow is disrupted. And PMS inhibit angiogenesis in the tumor tissues, suppressing tumor vascularization and reducing tumor growth, as shown in vivo studies. In vivo studies meaning live studies and not on a petri dish. I want to touch on angiogenesis because that is important. One of the new concepts in treating cancers is dealing with the angiogenesis. Angiogenesis is the production of new blood vessels. For the cancer to spread, it needs a blood supply. And it secretes its own chemical mediators to produce that blood supply. And that's probably the most dangerous part of the cancer, the metastases. That's usually the part that takes a person's life. So the PEMF inhibits the ability of the cancer to produce new blood cells. So that's a very powerful component. PEMF in breast cancer. And this is taken low intensity and frequency pulse electromagnetic fields selectively impair breast cancer viability. I remember at the start of my discussing PEMF, we spoke of low intensity, low frequency. And here it is in the study. So a common drawback of many anti-cancer therapies is non-specificity in killing. So healthy and cancerous cells are destroyed at the same time. So that speaks to what I was saying before in terms of chemotherapy and radiotherapy, where there's a toxic effect and you're not able to smart bomb the cancer cells alone. Expected benefits of PEMF is 1, cytotoxicity to breast cancer cells, 2, that the design fields proved innocuous to healthy cells that would be exposed to PMS during clinical treatment. In other words, when you're treating a person with the PMF, the cancer cells are killed and the healthy cells are not. Now, the breast cancer cells are called MCF7 and the healthy cells are called MCF10. They were exposed to PMFs and cytotoxic indices were measured. What was observed by the scientists was there was a window of vulnerability of the cancer cells to PMF at a 20 hertz frequency, 3 microtesla magnitude. That's just the protocol for the PMF for 60 minutes per day. The cell damage accrued in response, sorry, the reflection has me a little bit, to the PMS, increased with time and gained significance after 3 days of consecutive daily exposure. By contrast, the parameters for the PMF parameters determined to be most cytotoxic to the breast cancer cells and were non-damaging to the MCF10 cells. In other words, having used that specific protocol, they were able to measure the fact that the cancer cells were killed and the normal cells were spared. There was no damage. And this is from the American Association of Cancer Research. I spoke of angiogenesis. Before, daily PMF was found to retard angiogenesis and growth of human breast cancer xenograft and causing the tumor to develop proportionately larger areas of necrosis and hypoxia and smaller areas of proliferatively active cancer cells. It also demonstrated that the only PMF therapy daily PMF therapy continued to inhibit tumor angiogenesis and tumor regrowth for 2 weeks following a standard course of ionizing radiation therapy. So let me break this down. I spoke of angiogenesis, and that is the ability of the cancer cells to make new blood vessels in order for it to grow, and daily PEMF retarded it to the extent that there were larger areas of necrosis, meaning in the study where radiotherapy was used to induce necrosis of the cancer cells, where daily PMF was used, that area of necrosis was larger, the hypoxia and smaller areas of proliferative active cancer. That means that the areas of cancer that was expanding, in the case of using the PMF, that was reduced. And they're showing that that took place for 2 weeks following a standard course of chemotherapy, radiotherapy. So hence, specifically here, a study showing as an adjunct the effects of PMF, the positive effects. Next slide, please. So in summary, the result of the use of PMF is that the cells function better, hence the body functions better as a whole. And this is demonstrated in a noticeable improvement in a wide range of medical conditions, from arthritis to sciatica to fibromyalgia to anxiety to autoimmune disorders. Specifically in the case of cancer, 3 areas can be mentioned. One, as noted before, the ability of the body to fight cancer is improved when the person's overall health is improved. Secondly, in the case of cancer treatment, namely chemotherapy and radiotherapy, the health boosting benefits of the PMF helps to mitigate against the toxic effects these treatment modalities have. And thirdly, PMF directly stimulates the immune system with increased activity of certain anti-cancer agents, therefore having a direct effect in addition to the supportive effect it has in helping fight the cancer. And the previous studies mentioned show that. It is evident, therefore, that having heard the awful words that I started the talk with, you have cancer, that the more can be done than to be the person who had surgery and follow-up chemotherapy. I will further mention in passing the subject of off-labels, which came up in an earlier talk, the subject of off-label medications and established medications used to treat other medical conditions, for example, diabetes, hypertension, pain, acid reflux, to name a few. And they've been shown to have anti-cancer properties and have useful effects. There's also red light therapy. So in short, the message is more can be done. Next slide. PMF as an adjunct or palliative tool to fight cancer in Barbados. We've seen some theory. What's the real experience? The experience has been positive. The expectation for the use of PMF is, of course, guarded as it is a largely untapped treatment modality. Improved quality of life is largely the primary objective. Improved survival and remission of the cancer, though ideal, is hard to assess when PEMF is used as an adjunct. But its efficacy is more apparent in palliative care, where the other treatment methods may have been withdrawn, and the improvement in the patient's quality of life is clearly improved by the use of the PEMF. And we've treated a number of diagnoses, including pancreatic, Hodgkin's, multiple myeloma, breast cancer, prostate cancer, and colon cancer.